Welcome to this edition of the First Aid Show. The latest ERC First Aid Guidelines start talking a lot more about spacers and the importance of an asthma spacer when delivering treatment for an asthma sufferer. So what we're going to do in this edition is have a look at the spacer and also discuss how you use it. An asthma spacer is a large plastic or sometimes metal container that has a mouthpiece at one end and a hole at the other end for the inhaler to be placed in. They only work with aerosol inhalers, and they're designed to give a metered dose of medication into the lungs, which makes it easier to get the correct dose in the correct way. There are different types of asthma spacer, and some have face masks so that they can be used with infants. The actual training in using a spacer will be given by a doctor or medical professional, but we're going to look at the basics. The medication is delivered into the spacer, and the medication collects in the spacer, which is then inhaled. This avoids the need to get the timing and the speed exactly right. Spacers prevent the medication ending up in the back of the mouth or in the throat rather than in the lungs. Spacers make the drug more efficient because it's taken in more slowly. Therefore, it gets deeper into the lungs, making the drug more efficient, and they are just as quick as a standard inhaler in an emergency. Side effects are also reduced as they can reduce the amount of drug that's absorbed into other parts of the body, and the side effects like oral thrush are also reduced, which is a side effect of inhalers, particularly with children. Remember, actual training for the use of this is given by a medical professional, but spacers are basically used by taking off the cap and shake the inhaler. Put the inhaler into the end of the spacer. Breathe out gently as long as it feels comfortable. Put the mouthpiece between your teeth and lips, making a seal so no medication can escape. Press the canister to put one puff of the medication into the spacer. Breathe in slowly and steadily, not hard and fast, through the mouthpiece. Remove the spacer from your mouth and hold your breath for 10 seconds or for as long as is comfortable, and then slowly breathe out. And finally, if you need a second dose, wait 30 seconds, remove the inhaler, shake it, and repeat. As an alternative, if you find it hard to hold your breath, carry out steps 1 to 6 as above, and then keep the spacer in your mouth with your lips sealed around it and breathe in and out of the mouthpiece 5 times. Repeat each of the steps for each dose needed. Research has shown that breathing in and out in this way, using your spacer, is just as effective as holding your breath for 10 seconds. When using it with children, it's important to explain to them exactly what they have to do and why it is important. Then what you need to do is remove the cap and shake the inhaler. Your child can help with this. Put the inhaler into the end of the spacer. Place the mouthpiece between your child's teeth and lips, making a seal so no medication can escape. Press the canister once to put one puff of the child's inhaler into the spacer. Get them to breathe in and out of the mouthpiece 5 times. And finally, repeat from step 2 for each puff of the inhaler needed, remembering to take out the inhaler and shake it before each puff. After you use it, it's important to clean the spacer correctly with detergent, carefully, not scrubbing or damaging it. Leave it to air dry, and although they sometimes look a bit cloudy over time, they'll last for many months. If you have any questions, ask your medical professional.